Great, then let's get started. Good morning, everyone. Good morning. Opioid Settlement Board members, thank you for coming again this month. I really appreciate everyone's time. I'm Annalise Dolph. I serve as the co-chair along with Carrie Bergiotti. So welcome to this month's meeting. I'm going to turn it over to Jenny Thacker to get us started.
Good morning, everyone. Jenny Thacker. I am one of the facilitators for the Opioid Settlement Prevention, Treatment, and Recovery Board, and I'm happy to be spending this time with you today. Let's go to our objective slide. Thank you. So today we have two big things that we want to accomplish. We're wrapping up the conversation we started last month about how we're going to allocate opioid settlement funding in this 2025-2027 biennium that we're currently in. And we're also going to decide on a recommendation for the Research, Evaluation, and Data Subcommittee. So our plan today is to, of course, start with roll call and call for conflicts before heading into our board business. That will consist of a quick DOJ update, a fiscal update from Tammy, some program highlights, and then a RED subcommittee report. Then you'll consider the RED subcommittee recommendation. And before we continue the conversation that we started last month about the board's funding priorities and possible mechanisms for distributing this biennium's allocation, we'll have time for public comment that is specifically related to the funding priorities and mechanisms. And when we come back from the break, we'll spend the remainder of our time discussing and coming to a decision on how you want to allocate funds for this biennium. And if needed, we'll also have a few minutes for general public comment at the end of the meeting as usual. And then we'll go over next steps. So let's take a quick roll call. Lisa, do you want to lead us in the roll call?
Oh, sure. Okay, please let us know if you're here. April Roman. Adria Decker.
Here.
John is out today. Tammy Kane Suleiman.
Here.
Annalise Dolph.
Here.
Zebulai Payne.
I'm here.
Nicholas Ocone.
Here.
Lori Trieger.
Here.
Skylar Brocker Knapp.
Here.
Okay. Joanne Linville.
Here.
Julia Hyduke.
Here.
Carrie Brajati.
Here.
Rick is out today. Fernando Pena.
I'm here.
Sheriff Matt Phillips.
Here.
Rep Hi Fam.
Good morning, everyone. Rep Hi Fam couldn't attend, but I am here on his behalf. Sarah Kim, his chief of staff.
Thank you, Sarah. Senator Lou Frederick. Judge Celia Howes. That's all. Thank you.
All right. A pretty full house. Thanks, everybody. So Carrie, one of our co-chairs, suggested at our recent co-chairs meeting that it would be a good idea to remind the board before each meeting what the future you are working to build looks like. So in 2023, the board adopted this vision, and I will just read it for you really quickly, but it's also in your meeting packet if you want to refer back to it during our discussion today. So the Oregon State's Opioid Settlement Prevention, Treatment, and Recovery Board are working towards a future in which fewer people in Oregon use opioids to manage physical or mental pain or create a sense of belonging, resulting in fewer people with opioid substance use disorder. This will be possible because there's a robust statewide system of physician education and mental health supports for people of all ages. If people do suffer from opioid overdose, fewer die as a result because emergency responders and bystanders are equipped and educated to reverse overdoses. People who have opioid substance use disorder have unrestricted access to high-quality, community-based medical treatment options, regardless of how much money they make, whether they have health insurance, where they live, their race, their housing status, or their involvement in the criminal justice system. Care is coordinated and continuous when people move, whether it is from town to town or from the criminal justice system back to the community. Once people's substance use disorder has been treated, they have access to long-term recovery support services, including counseling, supported family reunification, employment support, etc. The board will know fewer of those who use opioids are dying as a result, and those who are in recovery are able to live rich, full, and meaningful lives. And again, that's in your packet if you want to refer to it during the meeting. Our next slide is our call for conflict slide. Just a quick reminder that we will not be making a decision on any specific potential recipients. And so just take a moment to read it and then let us know if you have any potential or actual conflicts. All right. Moving on to the next slide. Let's turn it over to Adria for an update on settlement happenings from the DOJ's perspective.
Good morning, everyone. I'm Adria Decker. I'm an analyst with Oregon Department of Justice, and I work on all of our opioid settlements in the context of DOJ's role. Today, I don't have any major updates for you, except to say that both Purdue and the Group of 8 settlements are on pace, and everything is going according to plan. Purdue will be sentenced later this month in court in New Jersey, and after that occurs, we'll have an effective date for the settlement, and we are in the process of getting all of the judgments together that will enable our receipt of the funds. So that's all I have that is reportable today, and I'll take any questions.
Adria, I have a question. Do we have any sense of how much the settlement from Purdue will be?
So we do have a sense of how we know how much we will be getting from the Sackler family. What we don't know is how much we will be getting from the bankruptcy estate, and that will not be knowable until probably next month.
And I'm not seeing other hands. Tammy.
Thank you, Jenny. Thank you, Adria. With that in mind, I just want to piggyback on the comment about not having the exact amounts yet. So I just wanted to remind everyone that the fiscal numbers you're going to be seeing in the slides today do not include the Purdue and the Group of 8 settlements, because of the fact that we don't have payment schedules and exact amounts and things like that yet. And all of my reference materials will be updated once we have some solid dates and information. And Adria and I work closely together to be able to coordinate and make sure that we have updated information and going both ways. So thank you for that. Next slide, please. So this table is the same as we had last month. We are expecting some payments to be coming in. We've been notified. So my expectation will be for our next meeting, we may see some additional revenue payments to be added to this table. But right now we're sitting at the same amount. We still have the same projection of the unallocated amounts available. And including also at the bottom, we have the AY25 from last biennium, the emerging issues bucket that remains available as well. Next slide, please. And we do have updated expenditures. We continue to make progress and see expenses coming through on all of the important work that the board has allocated thus far, including additional expenses in tribal and recovery and prevention that have come through. And we'll continue to track these every month and watch as the amounts increase as progress occurs. So right now we're sitting at 37% expensed for the allocations that the board has made thus far. Next slide. And the final slide in this section that I have for your update today just goes into review as we have discussion today about allocations going forward in this biennium, what we have available. Just wanted to provide for easy reference for you the breakdown of where the monies are coming from for the allocations that the funds that are available. Right now, with our expected AY27 revenue and payments, again, just restating that this does not include Purdue or the group of 8. There's 5.256 million available that has not been allocated because starting in the beginning of this biennium, the board had made a decision to allocate money to harm reduction Save Lives Oregon of 5.149 million. And then back in January, made the allocation for the burn program, the Behavioral Health Resource Network of 13 million. And then of course we have our tribal that the board decided of all payments, 30% is going to go to tribal, and we have to set aside for admin as well. So that leaves us 5.256 million from the payments that are expected for this biennium. We still have the 5.311 million that is from the last biennium, AY25, as emerging issues. And if you combine those two, there's a total amount available of 10.567 million available. So are there any questions about our fiscal update this month? Great. Well, we have some other slides that are going to be presented later to help guide information and discussion. And thank you for your time.
Okay, I'm going to share just a few program updates from OHA. So as always, we are having our local opioid settlement learning collaborative meeting tomorrow. They usually fall on the day after a board meeting. And as always, Adria will be sharing the DOJ updates. And this month we're highlighting Clatsop County. So Monica Steele is going to share what Clatsop is doing with their opioid settlement investments. And these are really, for me, the most exciting meetings when we have local jurisdictions sharing their work. It tends to be very engaging. And we do have a local opioid settlement learning collaborative website on the ADPC website. So that's where everything is kept, including meeting summaries and tools and everything you could imagine, including a quarterly newsletter. And if you would like to join the collaborative, the email address is right there, or you can just email me and I'll connect you to it. Next slide, please. Okay, and then I also wanted to draw your attention to 2 primary prevention grantees who are closing their projects out. The vast majority of our 56 primary prevention grantees projects run through June 2027, but we do have a few who elected for a shorter project time period. And so 2 of these grantees have completed their work plan activities. One is the Filipino Bayanihan Center, and they have been doing amazing upstream prevention work, including general health services, not clinical services, but connections to resources, discussions, pain treatments such as acupuncture and massage. They run a culturally specific food pantry that includes fresh vegetables. And something I think is so cool is they put together Filipino meal kits. And that has been really popular. And then they have a really strong after-school youth program. And they are more than willing to come and show you a few highlights of what they did. They have lots of cool pictures. And then one of the regional health equity coalitions, or the RHECs, of Marion, Polk, and Yamhill counties was a real shoestring operation, and their funding has allowed them not only to continue operations for community connection and empowerment, but they were able to obtain to hire staff that was able to get them 501c3 status. So they no longer need a fiscal sponsor, and that is huge. And then their other goal was to obtain at least 2 additional funding sources because they had this increased staff capacity for grant writing. And then they've also held lots and lots of community events on substance use prevention, immigration justice, getting people registered for OHP. So again, if you ever, once we have time to breathe, we'd love to start bringing in these grantees to share their good work with you. And that's it for me. I'll pause if anybody has any comments or questions before we go forward.
Seeing none.
Okay, thanks.
Good morning, everyone. Zach Johnson from the facilitation team. Just wanted to talk briefly about materials development for these meetings. So we heard at the last meeting that you want more time with meeting materials prior to the meeting. So what we're working towards is making sure that we have at least the bulk of the meeting materials to you 1 week ahead of the meeting, and working with co-chairs to finalize that materials list each month. And then if there are additions or changes that come in later, we'll send those as they come in. So you notice this month we sent the pretty long meeting packet last Wednesday, and then we had some public comment letters that came in later, so we sent those as updates to that packet. We're also working to include the table of contents on all of these packets going forward, just because they can get quite lengthy. So make that easier for you to reference specific items in your packet. So that's currently what we're working towards and what we're implementing for these monthly meetings. Are there any questions about that? Lori?
Thank you. Can we assume then when we get a quote updated packet that includes the latest one that says updated includes everything, or are the public comment letters separate documents?
So in general, we'll include them in the packet. So the most updated packet will include all of the letters that came in. In this case, one came in this morning, so that was emailed as a separate document. But other than that.
Great. I will just, for the record, say I haven't seen that. I've been in other meetings all morning, but that's great. Thank you. So they're just like addendums, so it doesn't
Yes.
numbering. Beautiful.
Yep.
Thank you very much. Appreciate it.
Absolutely. Thanks, Lori. Any other questions? All right. And with that, I will turn it over to Annalise for a RED subcommittee update.
Thanks, Zach. And I will just, I do have one comment on the last. I just want to thank you all for getting that packet out a week in advance and being very, very clear about what was added each time. That was really helpful. I know it's hard to get materials in advance, but it's really helpful to give folks time to review. So really appreciate it. So I am giving the update on the Research, Evaluation, and Data Committee. We do, good news, bad news, we do have a recommendation for the board to consider today. It is not a recommendation for how we will utilize the funding to fund the SUD data system that has been directed to the board to fund. But we have been able to determine that we're probably going to need a lot less money than what we had set aside. So it feels like progress in that way. So just so folks remember, we had a separate bucket for research and evaluation and a different one for the data system. House Bill 4098 puts the responsibility to fund a comprehensive SUD data system on this board, which I'll say publicly to everyone here. I've said it to a lot of folks recently. I don't think it was that fair to put this on this board. We don't have oversight over this data. We're not some may be some subject matter experts, but in general, we don't, and we are not data stewards for the data. So, but I also understand why the legislature wanted us to fund better data for substance use disorder. Anybody who follows the ADPC knows we're really passionate about this. So I think the RED committee has really been kind of struggling with where we fit in. You'll remember we made a couple recommendations to fund some projects for research and evaluation, but then said we wanted to kind of pause and see where the data work was going so we could see how we could maybe match those two things up. So last month in March, we had a presentation from OHA that is included in your materials with an ask for funding that if you've read it, you will note that presentation was asking for more funding that we are recommending that you set aside. The RED committee heard from OHA and their proposal and felt like it wasn't detailed enough, wasn't quite hitting the mark for where we were hoping to go. So OHA is going to do some more work internally to figure out how our funding can plug into their work to really focus on substance use disorder data in a very specific way. But it does seem like we have the potential, even with $1 million, which is what we're proposing to keep aside for data, to do a lot of work to move forward on an SUD data system. So the recommendation that I am bringing to you all is that the board reallocate, basically take back $2,974,445. Thank you for putting that up there, Zach. And leave $1 million in the bucket for the data system. We'd like to come back to you this year. This is not an ongoing, let's keep it out there for years on end with how that money will be spent. It's perfectly reasonable if we decide later this year, it's going to take longer to figure out how to spend it, and it'll be a separate ask down the way. But the committee, which also includes OHA staff, I will say, and ADPC staff, felt very strongly that we're not at a point yet to say how to allocate that money, but that the $1 million would be sufficient for the stages that we are at. I'm happy to take any questions and we'll answer them the best that I can. And we've talked a little in the meantime about next steps for this committee as well. Sheriff Phillips.
I think data is important for many of the groups. I was recently on a specialty or a treatment court work group, and of course we wanted to track data through deflection. We're tracking data. There's lots of data already being collected. Are we going to leverage existing data systems? Or I wasn't able to pick up by the minute or the meeting packet what we're trying to build with this $1 million. Is it leveraging something that's already existing or what?
So Sheriff Phillips, I will maybe start by just, how do I say this, validating you. I think it's been a little confusing for the board to think what is an SUD data system. Mm-hmm. There's products out there, to your point, that we could buy off the shelf that just kind of bring together publicly available data. But both the board as a whole, and then when we created this separate data committee, we really want to build on what we already have. So the gist of what's in the materials, and if any of the data people from OHA are watching and want to zing me, feel free to. But as I understand it, OHA is at an inflection point to really start to bring together some of their data internally, which quite frankly, I'll say with my ADPC hat on, in order for us to start really matching data across multiple state agencies, including some of our deflection data, ADPC actually has a project we're working on with that right now. We really need OHA to match their own data sets. So the data committee is really trying to figure out with OHA, this project that they already have to build a data warehouse. Could we inject some funding into it to basically supercharge the SUD data? And maybe they would start with matching some of the substance use disorder data points, which we've learned for states that are further ahead of us with healthcare data warehouses that cross systems. That's really where they started, because there are extra federal protections for substance use disorder related information. Does that help?
Yeah, I think so. It makes sense. Yes, the state does need to consolidate all the aggregated data that's floating around out there so that it's available and in a format that can be understood and used, right? All right, thank you.
And Fernando may be helping me out here. And all that to say, again, none of us here on this board are data experts. So that is why I feel a little protective of the board that we've been given this responsibility. Fernando.
Yeah, thank you. First, I want to say is that I am supporting this proposal and trying to handle this situation this way, primarily for the reason that it's been, what, 3 years or longer since we've been working on this project. And I'll be honest, at the last Red subcommittee meeting, I left feeling quite a bit disheartened to have a proposal given to us that says, turns out we have a lot of data that we're collecting. Um, we don't actually know if we can give you the product that you want or that we can provide you with the information that you need. So we'd like you to give us money to hire a contractor to see if we can give you what you need. And I felt that that wasn't robust enough of a proposal. It basically is written in a way that at the end, the answer could be, no, we can't give you this. And we spent $2.5 million. Um, and then there was a proposal in the meeting to come back with a different proposal that was more robust. However, we are 3.5 years into a project and now also living under tremendous budget shortfalls. And we just felt that maybe the way we were proceeding currently was not the best way to proceed. The $1 million is largely there as a placeholder in case a more robust project comes towards us. But we think it's time to start really looking at how we can maximize these dollars. Also, to Annalise's point, we've started down many, many roads actually at this point over the past 3 years for a data system, only to run into the same roadblock of, well, we're doing that already, but we can't actually do that for you, or some version of that. So I'm just putting this out there that this is more as just a way to honor the fact that we need to allocate funds that we've been sitting on for a long time at a time where those funds can be used more immediately. So I'm in full support of this kind of idea of just holding back that million, and we may come back in 6 months and say, you know what, you still haven't shown us enough to get that million. We're going to put it back into the pool. But ultimately, we're tasked with creating something that we as a board can't actually meaningfully create without support. And then we have no ability to impact how that support actually manifests itself. So I'll just end my comments there. I won't end them there. I can say I'm a little bit disheartened that after this many years, we're still kind of at this point. Because this is actually one of the compliance boxes that the settlement requires of us to do. And we still haven't done it after all these years and haven't really made too much meaningful headway yet.
Thank you, Fernando. So I will just add one quick comment to Fernando's last point for folks who are newer on the board. It was determined by the Department of Justice that the way the legislation was written, that we couldn't allocate any funds until we first funded the data system. So that is why we have had this sitting there for so long without kind of a proposal, et cetera. So that is part of the thinking with this, having this $1 million there. If we can't find something by the end of the year, then perhaps with other existing data, we could put forward to say that we're meeting the requirement of the SUD data system required by the legislation. Chair Phillips.
I was just thinking about what has been some of the challenges and why it's taken so long. Do we need to develop what the evidence-based indicators and metrics would be? Because I see that's step one for the contractor to do. I don't know. I mean, what if we provided the leadership on some of these items? And then, of course, I also do accept that, working with all the other data that's out there in the state, and all the systems that don't talk to each other, that is a challenge.
Yeah.
It's always going to be tough for us.
Yeah. And I think, and others feel free to hop in here on some of this history. So you'll see there's that little tiny $25,000. So we started by having an OHA internal contractor do a bit of a survey of data. That's what that little bit of money was on. We have talked, the data committee and OHA have talked some about what those early metrics can be. I think it comes back to this issue that we are not data experts. We don't know where we need to start. And that, I think, was maybe hopefully a breakthrough that came out of the last meeting and some subsequent conversations with OHA, is that the committee can weigh in on the usability of the data, right? The end product, but we are not the data stewards. So it's really hard when you're not the owner of the data and you don't know what the data is. So I think that is part of the reason why we've gone a little bit in circles. But hopefully I do have faith. I understand Fernando's frustration. I have faith that we are maybe at the cusp where we can say, OHA is going to start by matching these two data sources. And then we're going to work from there so that we at least have a starting point and something to point to say, this is where we're at. This is where the settlement board plugs in to get to the data system that we all dream about.
Thank you, Annalise. Are there any other questions about this proposal?
And I'll go more specific, Zach. Does anyone have concerns about basically what we're doing with the money? So this would bring the $3 million back into the bucket that we can allocate, but leave $1 million there. Does anyone have concerns about taking that action?
Not seeing any, no hands. I believe we do have a draft motion that I can pull up to this effect, if there is someone that would like to make this. Any takers for making this motion?
I'll make the motion.
Thank you, Julia.
Yeah, I move that the opioid settlement, the OSPTR board allocate $2,974,445 from the 2023-2025 data system allocation category into the 2025-2027 biennium general allocation budget to be used to fund board-approved initiatives consistent with the research, evaluation, and data subcommittee recommendation provided to the board on April 1st, 2026.
Thank you. Do we have a second?
Matt Phillips, second.
Okay, thank you, Sheriff Phillips. Any further discussion? Fernando?
Do we need to include in the motion some language around the reserving the $1 million there? Or does, whoever wrote this, does this cover that basically?
This covers that. Lisa, correct me if I'm wrong, this was cleared by DOJ and it's just pulling that 2.9 out of the fund and leaving the rest in there.
Correct.
Thanks,
Okay.
Fernando. Any other questions or discussion points? All right, I'll go ahead and call the roll. April.
Aye.
Adria.
Aye.
John is not here. Tammy.
Aye.
Annalise.
Aye.
Zeb.
Yes.
Nick.
Yes.
Lori.
Yes.
Skylar.
Sorry, yes.
Joanne.
Yes.
Julia.
Yes.
Carrie.
Yes.
Fernando.
Yes.
And Sheriff Phillips.
Yes.
All right, thank you, everyone. Now I will turn it back to Jenny.
Okay. Thanks everybody for providing that direction. We're going to spend just a little bit of time now walking through some things to keep in mind as you head into your deliberation before opening the room up to public comment. related to funding priorities and mechanisms. And then we will take a quick break, just 1 second, because I need to update a slide. Okay. All right. So the next slide shows the funds available for allocation in AY27 with the addition of those data funds. We now have a total of $13,542,332 available to allocate this biennium. And I did not successfully delete the next slide. So we'll just go to slide 25. Yes, thanks, Zach. Okay, so here's a graph that Tammy put together showing approximately where we expect to receive or when we expect to receive various settlement funds between now and the end of this biennium. And part of the reason that we wanted to show this is because this may seem obvious, but it's important to keep in mind that the board cannot distribute funds that are not currently in the account. So just something to keep in mind as we move forward with our next discussion. And then also something to keep in mind is the settlement ends in 2039, which is 13 or so years from now. And while there was a big drop between the settlement funds the state received in the last biennium, which you can see is significantly higher than what we expect to receive in this biennium and going forward, you can expect some stability over the next couple of biennia before the expected revenue starts kind of stair-stepping down for the final 4 funding periods. The exact numbers will change depending on, as Tammy said, some settlements that are still being finalized, but I think we can expect, as I understand it, the relative amounts to be more or less the same. So, the bars would look similar even if the amounts that they indicate might change a little bit. Okay, and then looking at other resources that the board has available to you in order to carry out the vision that you articulated back in 2023. Oh, Annalise, did you have a question? Do you want to go back to that last slide?
I did want to go back to that last slide real quick,
Okay.
Jenny. I apologize to interrupt your flow, but I did want to just add a comment here. Carrie, just on behalf of myself and Carrie, one thing I really want to emphasize with this and the conversation we're going to have today. Carrie and I had a really good long talk yesterday about where we're going as a board. And I really like saying this here with this slide because we do have some certainty about where we're going. And I know that folks have been really eager to have a conversation about how we think about this over this long term. And we keep getting pulled into these kind of like emergency situations. So I really just wanted to emphasize for folks as we go into this with this context setting that Carrie and I are very committed to us coming back to the table and having that longer term conversation later this year. We really want to have that conversation so that it isn't this kind of every 2 years and then we're at the end of the biennium and we're trying to figure it out. So that's one thing. We really want to reassure everyone we want to have that conversation about what it looks like ongoing, but also balancing the many, many requests that we have all had to really open up this pool, right? To give everybody a chance at this, what is quite frankly, a small bucket of money that we have right now. So I just wanted to put that context setting out there to everyone. And Carrie, I know Carrie's in and out, but Carrie, if you want to pipe in, I think it's something for the public to know as well. I know we're going to hear from a lot of folks today who had that round of that first round of one-time funding. And we've already heard from some folks like Lisa put out there, some of those grant funds are already gone. So that's something we want to think about in the future. But, we decided to come here today to think about, okay, how do we get out one more round of one-time funds and then go from there? So I just wanted to put that context setting out there because we do have some certainty about what this looks like over the next 13 years. So we can have those conversations, even if that's not the conversation that we plan to have today. And I see a bunch of hands up. I didn't mean that to be a controversial statement. I meant it to be hopefully a conciliatory statement. So hopefully I haven't taken us down a rabbit hole.
No, well, let's see. But I am so glad you shared that, Annalise. Thank you for interrupting my flow. Before Fernando, I turn it over to you and Sheriff Phillips, I wanted to see if Carrie had anything to add. I know, Carrie, that you're kind of in and out, but I wanted to give you
I'm here, and I just really appreciate Annalise. One of the things that I love about working in community, working with other people, is that we all see things in different ways, and it helps when we hear from other people. It helps us craft our own thinking about it in a way that we wouldn't be able to do on our own, right? And so I really want us to be committed to finding a long-term strategic way to manage these funds. And it has at times felt like we're responding to an emergency because guess what? We're responding to an emergency. And I think that knowing that we as a board can commit to having a long-term strategy with these funds after we make this decision today about how to get this biennium's funding out in a one-time way makes me feel better about doing that. I guess if that makes sense. So I just really appreciate everybody's thoughts on this, but really just want us to keep that long-term commitment in our minds as we have this conversation today.
Carrie. Fernando?
Yeah, I just have a clarifying question about the slide. These numbers are aggregate estimates. Do these numbers include the 30% tribal set aside? Is this the money after the tribal set aside, or is this estimates including the tribal set aside?
The numbers that you're seeing reflected here are the total revenue. So there's been no tribal set aside removed. There's been no set aside for admin or anything like that removed as well. This is expected revenue in total by biennium, and also not including settlements that we know are forthcoming but are not finalized yet.
Awesome. Thank you. The reason I wanted to just put that out there is to emphasize the point that this is a small pool of money and will be getting smaller, and a percentage of it is already allocated towards in perpetuity. And so to further emphasize the point of like, this is a shrinking pool of money and we have to be coming up with mindful process for things.
Thanks, Fernando. Sheriff Phillips?
Well, as you know, from our check-in, this is kind of the conversation I was really hoping we were going to have. How can we be more strategic? But I guess what I would like is that this board is able to leave a legacy, that we make decisions that somewhere down the road, somewhere, after 2039, someone looks back and goes, wow, those folks really did something thoughtful that made a difference. Along those lines, it was just mentioned we can't spend money that we haven't received yet, but I think we also have a few years to spend the money that we've received. So in a way, we could level the amount of money we allocate over time, and probably allocate or appropriate money to entities after 2039, correct?
Tammy or somebody from the fiscal team?
I'm wondering if Adria can answer that.
Yeah.
Do we have
Just
5 years
unmuted myself.
past?
Yeah,
Exactly,
5 years
5
for
years.
receipt.
Yeah.
Or 7 in case of capital improvement.
So, but with that in mind, I would think that we should think about what can be those really lasting programs that, or something that we can set up and get in motion that will survive long after we're not involved anymore.
Thanks, Sheriff Phillips. Skylar?
Yeah, sorry, I've got a lot of different emergencies happening, so I've been in and out, so I apologize if someone mentioned this already, but I think to Sheriff Phillips' point, one thing that I know we're struggling at the local level and doing is kind of exactly what he's talking about, and it's a much smaller amount of money at the local level, but I think a lot of us fall in, we've talked about this as a group before, but fall into that pitfall of trying to fill budget holes as budgets are reducing, really trying to keep programs going that are doing amazing work, which I think is great. But that longer term, more systemic approach, I think is needed. And I think this group really wanted to focus on that and has been really clear about that for years now. So I think thinking a little bit about how our investment is maximized in the community, whether that comes with not just learning about what people are doing, but really trying to engage in systems change or different conversations with other governmental entities to say, this is a system we want to work toward, and we're going to provide you that roadmap. And like, we hope that local dollars also fit into this roadmap and this systems change, and anything we can do in that space, I think, to really make sure we're maximizing our investment for longer term systems change in the state, because I know we desperately need that. I think it's a unique opportunity to leverage some dollars, and whatever pieces we're able to do that, Adria will tell us what's possible and what's not legally, but I think there's an opportunity for us to try to change the trajectory of the state and not just patch holes. And so I really hope that we take that seriously, and I want to try to do that at the local level as well. And easier said than done, but I think there's a good opportunity there.
Thanks, Skylar. Sheriff Phillips will give you the last word on this.
Yep, and I'll make it quick. I think that if we do this right and we make very clear what our programs and priorities, how we're going to support things, what our plan is, our strategic plan is, will protect us in the future. Because right now I think we're viewed as a piggy bank. Because at first it was Save Lives Oregon asked for 26 million. More recently, the state was looking for 28. Right. I would like to build out a plan where everyone knows that how we're going to spend the money for the next 13 years.
Thanks, everybody. This good piece of context setting. Fernando, do you have
It's a quick question,
Okay.
because I may be having some stress-induced memory loss right now. Have we had the ADPC come and present the updated strategic plan that is now in force? Because we're using the word strategic plan a lot. And one of the things that we've done at the ADPC is to really mindfully start creating a strategic plan for the state that answers some of these questions, that builds and doesn't buy a system. We're not going to have enough money to buy a system. We're going to have to build it. So I want to counsel us to be careful to start setting too many quote unquote large strategic priorities that aren't going to be in line with that plan, because that plan is the plan for the state.
We did have the ADPC come and present the strategic plan just after they finished community engagement. Is that right, Annalise? And
we did talk during the community engagement process. We did not come back after it was finalized. And thank you for that, Fernando. Yes, by statute, it is the plan. I don't think we've had those kind of deeper conversations to think about where our funding can fit in precisely.
Yeah. And I think, as you put it, Annalise, this is a conversation you and Carrie are looking forward to having with the board. Adria?
Yeah, I'm sorry. I just wanted to correct myself from what I said earlier about timeline to spend. That 5 years is for subdivision funds. The interstate agreement is actually silent on state timeline of expenditures. So that would be up to this board and whatever the statutory requirements are, which I also think is silent, but I have not reviewed that with an eye towards that.
Okay, so when we do have that more strategic conversation, that's something we can talk about. We can add as well. All right, so I want to be mindful of time and make sure we have time after the break to finish our bigger conversation about about how we're getting the funding out this biennium. So just looking at the resources that are not dollar resources that this board has available to you on the next slide. We have, of course, the OHA staff time that is in kind. So there's a little bit of funding from the settlement board that goes to pay some administrative costs, but OHA is also contributing other considerable staff time. And also there are local experts in the field already who are doing excellent work. There are existing prevention, treatment, and recovery and harm reduction infrastructure that this board can leverage and continue to support. And then there's your time and expertise as well that you are contributing. And last slide on this context setting is just a little bit about what has happened in the past. So how has the board distributed funding so far? So with a few exceptions, you followed this pattern that you see here. So ADPC made a recommendation based on their research and expertise. Based on that recommendation, funding was either directly allocated, as with the funds to support 5 recovery community centers or the regional health equity coalitions, or an RFP process was put into place, as with the focus grants, to support culturally and linguistically specific services like the Filipino Bayan Center that Lisa shared about today, and grants to 5 other recovery community centers. There's more detail about this in the, there's a link in your packet that goes into greater detail about this. In the harm reduction and research and evaluation categories, the board essentially requested presentations from specific organizations and then directly allocated funding based on those presentations. So just some things to keep in mind as we move into our conversation following the break. But before the break, we're going to have our first public comment period. It's the first of 2 public comment periods. Annalise?
You probably see me furiously finding my notes here. Thank you so much, Jenny. Yes, so first of 2 public comment periods today. Normally we hold 1 public comment period at the end of the meeting, but we know that some groups are here who wanted to comment specifically about funding priorities and potential funding mechanisms. And we wanted to make sure that the board members could take those into consideration in our deliberations after the break. So we'll hear those comments now, and we'll hear general public comments at the end of the meeting as usual. And our statement for everyone offering public comment: the Opioid Settlement Prevention, Treatment, and Recovery Board welcomes and appreciates public testimony. We will do our best to not interject during public testimony. So i.e. we will not respond. We will, however, bring into fully into our awareness, understand it as an important consideration for our work, and listen with careful attention and respect. We want to acknowledge that time held in our meetings to hear public testimony is meant to provide a voice and perspective from that individual, and is not a representation of the Opioid Settlement Prevention, Treatment, and Recovery Board, its members, or the Oregon Health Authority. The important logistics: each presenter is given 2 minutes to share. If that doesn't feel like enough time, please submit written testimony. We have allocated a total of 10 minutes for public comment. So I know sometimes that means we have to shorten. So I will rely on our facilitators and Lisa to correct me if folks need to be shorter than 2 minutes. So we will have a timer, and we really ask that folks conclude their presentation when the timer is complete.
Thanks, Annalise. We do have, I believe, 5 folks who are signed up for this public comment period. And so we will keep time, and we'll start with Heather from the Deschutes County Public Health.
Thank you. Hello, my name is Heather Keisner, Public Health Director at Deschutes County. Thank you for allowing me to provide public comment. As stated in my letter, I want to express gratitude for the funds allocated to primary drug prevention by this board and to encourage continued funding in Oregon. Resources for prevention programs have been insufficient, unstable, and stagnant across Oregon for far too long. Through this board's investment, Deschutes County has been able to bolster our workforce and ensure important initiatives to address primary drug prevention, including our Upshift and Healthy Schools programs. Upshift is an early intervention program to reduce current use and prevent escalation of substance use. Students are recruited for the Upshift program primarily through the school disciplinary system with a substance use policy violation. Of students that participated, 87% successfully completed this program, and in follow-up surveys, 89% of students either quit or reduced their substance use. We've also had several successes through our Healthy Schools program in partnership with our largest school district, where we embed prevention specialists in our middle and high schools. This Healthy Schools staff train teachers in the required opioid overdose prevention lesson from the state, and now 96% of teachers are teaching that lesson compared to 67% the previous year, which reaches about 5,000 middle and high school students. And a recent evaluation of our Healthy Schools program also demonstrated that this program was associated with preventing 21% of behavioral health related emergency department visits among youth. Prevention has a tremendous impact that improves the trajectory of a youth's life as well as cost savings in our healthcare system. Please continue to allocate resources for my primary drug prevention in Oregon. Thank you.
Thank you, Heather. And next we have Jennifer Little.
Hi, good morning. Can you hear me? Hi, I'm Jennifer Little. I'm the Director of Klamath County Public Health. I also submitted a written comment, so thank you for the opportunity to speak. And I really appreciate the thoughtful conversation that's happening in these meetings around strategic investment. I'm also here to ask for your continued prioritization of funding of primary prevention, which is specifically called out in the ADPC strategic plan, as that gentleman had mentioned. In Klamath County Public Health, we do have an overdose prevention program, but it does not support a full-time person. We also work closely with our alcohol and drug prevention program, ADPEP, which is at our local mental health authority, Klamath Basin Behavioral Health, who I think you'll hear from later. And even with these strong partnerships, our prevention programs across the state remain severely underfunded. And in our case, we don't have a full-time person covering a county the size of Connecticut. With sustained investment, we can fully staff these programs and better reach our rural communities and create lasting change. We've seen what happens when prevention funding stagnates. We see substance use disorders rise, and we know that prevention works. Research consistently shows a strong return on investment, saving many dollars for every dollar spent. And we really need to break the cycle of neglect, panic, respond, and repeat. Real outcomes require long-term commitment, and these one-time investments, although very appreciated, aren't enough to build an effective program and create systems change. And we know treatment and recovery are critical, but without sustained investment in prevention, we'll continue to face these rising costs and ongoing harm. Thank you for your time.
Thank you, Jennifer. Next is Mackenzie Folsom.
Hello, can you guys hear me? Perfect. All right, thank you for hearing my public comment today. My name is Mackenzie Folsom, and I serve as the alcohol and other drug prevention education program coordinator in Klamath County. I work at Klamath Basin Behavioral Health, and I'm here today just to provide some information about primary prevention efforts in our county. So prevention programs across Oregon are chronically underfunded, and in many counties, especially in rural areas like Klamath County, funding does not support a full-time prevention position. This really limits the reach and sustainability of evidence-based prevention strategies. In Klamath County, our mental health authority, Klamath Basin Behavioral Health, where I work, does provide additional financial support because they do recognize that it is very important, but that is not sustainable long-term. And it's not a capacity that all counties have. So during this current funding cycle, this one-time funding was added, and that was allowed measurable short-term outcomes in Klamath. So in less than a year, more than 250 youth have participated in programming focused on protective childhood experiences to really counteract ACEs. And then over 400 students have received education regarding opioids and fentanyl. And these activities align directly with evidence-based prevention frameworks as well as the ADPC's strategic plan. So prevention is long-term and it is upstream, and stable infrastructure is necessary to really efficiently plan, staff, and evaluate programs, as well as to sustain community change for both prevention, treatment, and recovery. Thank you.
Thank you, Mackenzie. Our next speaker is Nirmala Dar. I don't know if Nirmala is with us now, but yeah, I'll hand it over to Dr. Dan Hoover in that case. We'll see if Nirmala joins.
Thanks, Jenny. Good morning, co-chairs and members of the board. I'm Dan Hoover. I'm an addiction medicine physician at OHSU and the director of our jail MLUD technical assistance program. I want to start by thanking you for your investments expanding access to medication for opioid use disorder, MLUD, the most effective life-saving treatment we have for opioid use disorder. In 2024, the board provided funding to my team for jail MLUD technical assistance along with the opioid treatment program expansions. This was really strategic timing with the launch of House Bill 4002's jail MLUD grant program that's administered at the Oregon Criminal Justice Commission. We recently surveyed our partners, our clients in the technical assistance across 7 jails, as well as the Oregon Youth Authority and the Department of Corrections. And we heard that our technical assistance is increasing readiness to treat opioid withdrawal, connecting jails to community treatment partners, and helping jails meet their goals for grant funds. I'm hoping to share more from this evaluation with you at a future meeting. My most important message for you today, though, is that there's still more work to do. Some jails are just getting started here in 2026 and need support to build programs from the ground up. We also continue to see gaps in methadone access that can result in patients having methadone withdrawal in jail. And addressing these gaps needs stigma reduction at the jails, stronger partnerships, and a lot of times new infrastructure for jails so that they can bridge methadone care when that's needed. In summary, the jail MLUD technical assistance is a modest but essential infrastructure investment. By strengthening connections between jails and the treatment system, we can improve care at the jails and accomplish safer transitions when individuals release to the community. I ask that you renew the funding to my team so we can continue this important work. Thanks for your time today.
Thank you, Dr. Hoover. One more call for Nirmala, and if you're not available now, we also have our second public comment period
Hey,
at the
Jenny.
end of the meeting. Yes.
Nirmala mentioned that she had already presented to the board last month, and so she resent a letter that she had submitted over a year ago, and it's in the packet. And she wanted to draw your attention to some recent data regarding older adults and the opioid crisis. So that's all in your packet. Thank you.
All right. Thank you, everybody. So that's our first public comment period. We're going to have a second one after our discussion. And I think with that, we head to break, right, Annalise?
Yes, I know we're running a little behind. Do you still want to take 10 minutes?
I think
Jenny,
10 minutes
or-
is
okay,
fine. Yeah.
maybe say 11, so 11:16. See everyone in 10
See
minutes.
everyone then.
All right, everyone, it is 11:16. If we can all come back together. Welcome back. Hope everyone had a good break. Just give it a few more seconds. All right. We can go to the next slide, Jenny. All right. So for the next part, for the rest of the agenda, actually, we're going to be talking about funding mechanisms and how you would like to distribute funds in this biennium. So as we get started on that conversation, if we can go to the next slide, the co-chairs just thought it would be helpful to remind you where we ended up after the March meeting. So if you remember, in that meeting, we split into 3 small groups and talked about funding priorities. And 2 of these groups moved quickly to talking about funding mechanisms and recommended moving to an RFP model with some small differences between Group 1 and Group 2's approach. And then the 3rd group recommended a fairly even split between prevention, treatment, and recovery categories, and then doing the funding conversation at this meeting. So based on that, we're going to get into a discussion about how the board would like to proceed with that information and what your priorities are. So just starting off, there was significant interest in an RFP process at the last meeting. Is that still the case? Do board members think that an RFP process is something that you would like to pursue for this biennium? Fernando?
Yes. However, I want to add some nuance a little bit. It's not just an open RFP, it's that we would be creating an RFP where we also create the review categories to ensure that what group 3 wanted, which is that we're allocating to each of the buckets. So we would be waiting. So it's not just like we're going to use an RFP free for all. It's we as the board will create the structure for evaluating the RFP.
Thank you for that additional nuance, Fernando. Sheriff Phillips?
Well, I guess based on the conversation earlier this morning and my conversation during the check-in, I feel like I'm almost in a different place than where I was a month ago. And we talked about being strategic. How can we make a long-lasting impact? I think an early decision to give the 30% for the tribal set aside, I mean, that makes a statement and hopefully makes a really big difference for those folks, right? I guess I'd prefer to see something where we can very strongly support an area for the long term so that we can make a difference there instead of sprinkling resources out over a wide area and maybe have unknown successes.
Matt, when you say area, an area, do you mean like a geographical area or one of the categories, or
like in a category? Like there was a lot of support for prevention, and I was sitting here thinking, like, of all the resources in the state that are going towards opiates and other substance abuse, how much is going towards prevention? Can we quantify that? We can maybe get close to quantifying statewide how much is being spent on harm reduction. Maybe, I don't know. How is there an area we could say, where is the biggest need? Where with our limited resources, we could say, you know what, we are going to go all in and hopefully really make a difference in one area. Maybe I'm being too optimistic, but I'm hopeful that we can identify something.
Thanks, Sheriff Phillips. So almost like a gaps analysis in a way about where the missing pieces are. Okay, Annalise?
So I'm responding to Sheriff Phillips' question. So we have a rather old gaps analysis from that. I don't know that I would revisit. The board did review it. We do have spending analysis. We have one from 21-23 for that biennium across the entire SUD spectrum, and ADPC is now working on one for 23-25. And it does tell you where the funding goes across the continuum. So that is information. I will just pitch in, kind of going back to my, what I was saying earlier. I mean, I think not to put too fine a point on the original question that was asked of us, do you want to do an RFP or not? I don't think doing an RFP for this $13 million on a one-time basis precludes us from having this bigger conversation going forward. I think it's more, you know, that we've had these conversations. I hear you, Sheriff Phillips, you're in a different place now. I think we just have to decide today, like, do we want to say, we're not going to allocate any more money for the rest of the biennium, and we're going to roll this into what's going forward and give ourselves some time to do that? Or are we going to do this one time RFP process, which I can't emphasize enough. Yes, we are hearing from folks who currently have funding from us, but it was a very closed process, even with the RFPs, the way we did it before. So we really have not had kind of an open-ended process where folks who aren't already connected to the state or state entities have a chance to come in. And that may not feel like the most strategic thing, but it's hard to know if we haven't done that before. I think I might be babbling now, but I just hope we can kind of decide which direction we're going to go today, so we can go one way or the other.
Thank you, Annalise. Lori?
Thank you. Not babbling at all, Annalise, the perfect bridge from the point that Fernando made and what I wanted to say, which is, to me, the question isn't RFP, yes or no. It's us designing the criteria, because we had a lot of conversation about the accessibility of even knowing there's an R out there. Who finds out about that and how, and then against what do we measure it? Because to Matt's point, I mean, prevention's always and forever chronically underfunded, and is ultimately the long-range solution to pretty much any public health problem, is better investments in prevention. But just knowing that isn't enough of a criteria. And just looking at dollars doesn't really give us a picture, right? I don't want to throw a whole lot of dollars at something that's, you know, sort of a random one-off. Not that there aren't huge successes that can come out of random one-offs, but I mean, it's more nuanced. There are more criteria that we need to establish. And to do that, I think this is what we were going to hopefully get to at our retreat, that sort of got that went sideways with a very specific request, and we didn't get to really dig in and talk about beginning with the end in mind, getting back to what are we trying to accomplish, what are we trying to support and lift up and strengthen in a system that exists, fill gaps that don't exist in the system or are part of a reimagined system that we know is actually the one we need. How do we determine where best to make the investments to meet that? That's the conversation that that was my understanding we were going to try to have in January and didn't get to have. And so by saying an RFP process, but before we put it out there, we have conversation about how to shape it, how people find it, how the requests are scored, is actually the conversation that we are ready for and would be the most useful.
Thank you, Lori. Yeah, definitely hearing a lot of comments already about that process and how that would look. So back to Annalise's point, I think if we agree that an RFP is the general direction we want to head, then we get into the further conversations about how that's structured and what we want to prioritize in that. So today, if we could focus on if that general process seems to fit what this board is looking for, I think that'd be helpful for moving us forward. On that point, what are the advantages of opening up an RFP process? We already heard that it's a little more accessible to folks that are already connected. What else does the board see as benefits to an open RFP process like that? Fernando?
Well, in the name of equity, an open RFP process where we also craft the evaluation, we can open the door for organizations that don't normally get funded, or projects or programs that don't even get taken seriously, because they don't already have the current grant infrastructure in place to obtain some of the larger, more in-depth or involved grants. That's one of the one of the biggest equity issues that we have is actually equity in grant making. And current systems always prioritize established orgs and established projects, especially if they have history already with the groups providing the grants. And so this is just a way to open access to some other communities.
Thank you, Fernando. We'll do Lori, Nick, and then April, and then Zeb. Lori?
Thanks. And just to add on to that, absolutely. And I wonder if it also doesn't open us then to more essentially creative approaches. I think about the report we just heard from the Focus grant that culturally specific food boxes are part of, right? Is creating front doors and access points to SUD treatment and programs through a non-traditional path. I mean, it's what community health workers and traditional health workers do all the time. We don't think of food pantries as substance use treatment, but they are a door, a path, because they're relationship based. And so it gives the opportunity, if we shape it right, for people to see in this funding opportunity, to see their program in this funding opportunity in a way that if it's just, are you providing, opioid use disorder treatment services? And so I think we'll get some much more creative and connected to grassroots and therefore more equitable approaches, and often much smaller dollar amounts that have huge impact in programs like that. So it could be an opportunity to spread such limited funding further to have even greater impact.
Thanks, Lori. Nick?
I really want to build on what Commissioner Traeger and Fernando just said. I think the opportunity to get a really broad view of what ideas across the state would be to like really open our minds to what ideas that the community would have would be fantastic. On the flip side of that, it's like recognizing too that like we don't have endless dollars and there are going to be folks that apply that don't get awards, and recognizing that some of these agencies don't have a lot of bench strength. So like just making sure that we are making it accessible and not too arduous so that folks aren't putting a ton of work into this if there isn't going to be an opportunity to like to actually fund all of the projects.
Thank you, Nick. April?
Thanks, Zach. I really appreciate the conversation where folks are heading, which that sounds like we're already starting to wrap our heads around the design of an RFP process. But I think your original question was, what would an RFP provide? And I think in my mind, I go to what's the alternative? Because I think that we have what we have done before, which is a little like a but a lot of sort of just like through relationships or direct connections through OHA. And at the same time, my concern and maybe from my position here would be around OHA's capacity to provide support for an RFP process. I'm imagining this group meeting once a month isn't going to be enough to design a process and then receive communication, provide TA, whatever else is needed to have a fully equitable process. So given, the amount of admin we do pay for this board at OHA and the capacity that is donated, I heard a lot donated today. So is OHA able to share a little bit about what you've been thinking? We talked about this last week as a possibility. We've been talking about it for the past year as a possibility. Can you speak a little bit about the capacity on the contracting side to manage a process? And then I think it would be really helpful to know what guardrails would be there so that we can weigh the same things we were weighing the first time around: speed versus scale and capacity, as we are making the mechanism decision here, which I think is what we're trying to do.
I can answer to this. So thank you for bringing this up. OHA staff is typically at capacity, and running an RFP takes a lot of staff. And we actually had a meeting with OHA leadership and Annalise yesterday to find out how much capacity OHA has to do something like this. And it can be done, but OHA leadership would need to help us with some FTE, and they have expressed that they would definitely assign staff to help with this. We do have a lot of experience engaging community-based organizations and lessening barriers. Happy to share those lessons learned with the board. I put something in the chat. The National Academy for State Health Policy has put out a really cool toolkit for using opioid settlement dollars to partner with community-based organizations. And there are actually a couple of examples from Oregon in the toolkit, the focus grants and I think the regional health equity coalitions. And so it might be interesting. I could have somebody come in and share this toolkit with you and give a presentation on how to lower barriers. But can OHA conduct an RFP process? Yes, we just need to be really realistic about the time frame. Then, and the other point is that remember, the funding isn't all in the bank now. So if the board decides that they want OHA to administer an RFP, we'd have a lot more wiggle room this time for community engagement, more time for that. So something to consider. And another thing that we discussed was maybe the board wants to allocate a portion to an RFP, maybe not the entire, for something really specific, such as culturally specific work, or, that's another option I just wanted to throw out there. Whatever the board decides, we're happy to implement it. We'll make it happen.
Thank you, Lisa. Zeb?
Hi, thank you, Lisa, for that. Yeah, I just kind of want to echo some of the stuff that Commissioner Trigger said about grassroots organizations and stuff, and how much, limited dollar amounts can help a community and organizations like that and impact the community. It's immeasurable sometimes just how much one organization or two with a specific vision and how to help their own communities can really do. I like the idea of people coming to us with needs from their own communities, specific things that they believe that will work, that can help. And like Fernando was also talking about, giving access to people that don't normally have access to the regular system and access to funds. So I like the idea. Thank you.
Thank you, Zeb. Okay, so I'm hearing a lot about the importance of getting the logistics of an RFP right, making sure there's the capacity there, making sure that we're doing the engagement and lowering the barriers for organizations to participate in an RFP process. But so far, general excitement about the idea of opening up some sort of RFP process because it would bring new ideas to the table. Are there disadvantages to an RFP process? What difficulties might we face?
Well, RFPs are long, slow processes. And so like we had said, we're trying to balance between speed and strategy and the moment we're in. So
Thank you, Fernando. Carrie?
Yeah, I think kind of long, difficult processes. I think it's already been alluded to that this is probably going to be a little bit of a lift for OHA staff and maybe more of a lift for the board. And I think a lot about the equity conversation that we're having and wanting to open it up, and I've been a pretty strong advocate for finding ways to make dollars available to people that aren't already connected with the system, because we're trying to like break down barriers within the system. But it's still really hard for people to apply for RFPs, especially small organizations and even well-resourced organizations like ours. Like we have people, we're pretty large relatively compared to other nonprofits, but having the capacity to write grant applications is still really challenging. And I think that it is in a way contributing to piecemeal funding that can be really challenging for the organizations that we're trying to support in building systems to address these issues. Am I saying any of this to like dissuade us from doing the RFP? No, I think that this may be what we need to do for all of the reasons that have been stated, but I say it because I think it is stuff we could maybe contemplate and consider and have at our mind while we're building this process and moving it forward.
Thank you, Carrie. Sheriff Phillips?
Sorry about that. I was just thinking, I know equity is very important for this board, but also it really reduces potentially the reach in terms of the number of people that we can help. So an example of that is the 30% tribal set aside. I think of the 9 recognized tribes, there's like maybe 25,000 enrolled members and maybe 180,000 folks that identify as a member of a tribe. So that's just a couple percent of the global population of Oregon. But because equity recognizes to get certain groups up to a level playing field, they get disproportionate help, right? So I think we have to be clear that equity does not mean helping more people. It means helping certain groups more.
Thank you, Sheriff Phillips. Lori and then Joanne.
Thank you. I appreciate all this. I wonder, I guess I'm moving toward, I'm getting impatient. I'm like, call the question, because I appreciate what everybody said, and it's all true. Multiple things are true, and some of them seem in conflict, but the overarching, what I'm hearing is support for it. And if that's true, I don't know if we just need like a thumbs up, down, or sideways to see if that's true, then we can shift into the how we go about it. And to Carrie's point about it can be, you know, onerous or for people to apply, and it can be slow. I will just say from experience, when we had an influx of ARPA funds at the county, we first went through and did allocations based on, you know, clearly urgent needs impacting county operations from the pandemic, but we opened up a smaller community grants fund, and we kept it real streamlined and real straightforward and real simple. Even as a government, we were able to do that. So it can be done. And it can be really responsive with quick turnaround and low barriers to both entry and to reporting. There are models out there. It can be done. Thanks.
Thank you, Lori. Joanne?
I agree that probably with every statement that has been made, we having done grant proposals, I know that they take a lot of time, and there is an expectation of funding. And so I guess what my concern would be is that if we put an RFP out, that we're very specific about what that request is planning to fund, and that we give very clear guidelines to those applicants so that they can focus and meet the requirements of the RFP, and that we don't just have this big general thing that says we're open to accepting requests for funding, and then have agencies or groups take a lot of time and effort to put a proposal together and a budget, and then for us to not be able to get adequate consideration. So I think I know it means that we have to do some work up front if an RFP is going to go out, but I think that's important for us to do.
Thank you, Joanne. All right, definitely hearing a lot of support for the general direction, so that's good. Before we take potentially a little straw poll on what we're feeling, to Lori's point, I just wanted to open it up for anyone that was in group 3 last time, which had initially proposed doing more of the buckets like we've done in past years instead of a RFP process. Is there anyone from that group that would like to talk about what they're feeling now that they've heard a little bit more discussion?
I was in group 3 last time. I'll jump in. Sorry to not raise my hand. I don't think that they're mutually exclusive at all. I feel like we can have an RFP and really, as a board, still really look at making sure that we're potentially distributing across the 3 different primary areas pretty equitably, and ensuring that we're investing in these areas to build the comprehensive, system I think we all want. So, you know, having been in that group, I'm definitely not opposed to this idea at all.
I was always also in group 3 with Nick, and totally agree. I think our main objective with the way we came out of that group was making sure we didn't lose sight of the continuum of care, and that we didn't prioritize emergent needs over establishing a continuum for years to come. So agree with Nick that it's not mutually exclusive, and that this framework would work with our recommendations.
Thank you, Nick and Adria. All right. I think at this point, we're not like at a formal motion or recommendation, but I think it'd be great if we could get a thumbs up if you're generally in favor of moving ahead with an RFP process, and then we can get more in depth into that discussion about what we want that process to look like and include. So you can either thumbs up physically or through an emoji. Okay, seeing support generally. Okay, and head nods.
Sorry to butt in, Zach.
Yep.
I'd also like to point out that I pasted a link to the focus request for grant applications that OHA conducted, just so you could see an example of what that looked like. And maybe it's something that between now and next meeting, you could look at and think of ways where that could be adapted to what you want.
Thank you, Lisa. All right, so definitely a lot of head nods, thumbs up. So I think we can say that that's the direction we're heading in. We want to do an RFP process. So as we think about that RFP process, y'all have already brought up some great considerations about making that an easy to access process, an equitable process. What other items should we be considering as we start designing that process? So first off, what steps do you see to creating a workable RFP process? Fernando?
Yeah, I'm sorry, man. Zach, I'm gonna derail your question a little bit here. I think we're starting too broad. I would prefer it if rather than us whole cloth saying this is what we need for an RFP, to Lisa's point, there are other there's better starting points than rather than starting so broad. I feel like the actual physical mechanics of an RFP can well be handled by those with the technical expertise of that, which is why we asked what OHA is capable of. I think the question for us is what do we want to prioritize with funding? And maybe we'll be getting that later, but starting off like what should be in an RFP is not, it's too broad.
Thank you, Fernando. Sheriff Phillips?
Yeah, Fernando basically stole my words. We need to identify what we want them to propose on. And like Fernando said, let the experts hammer out the details of what that language looks like.
Great. Heard that loud and clear. So as you think about what you want an RFP, what you want people to submit proposals on, what comes to mind as, you know, what you would like to see proposals based on?
Well, I'm going to go back to previous comments. Sorry, I didn't raise my hand.
Oh, good.
We're talking about strategies, and we have already mentioned that the ADPC has created a strategy document that statutorily aligns these priorities for the state. So I also don't think that we should be starting quite from such a general place just to run up against something that's in the strategic plan that contradicts or that can't be, you know, and Annalise, I apologize if I'm understanding how this whole thing is supposed to work, but we do have a strategic plan for the state focused on how to answer some of the strategic questions we are trying to answer.
Annalise?
So a response and maybe a question for the group to help with the discussion. So the comprehensive plan certainly frames out what a continuum of care should look like, and steps that the ADPC is putting forward across state agencies to implement. There are priorities set for the Opioid Settlement Board that we fund things that are not otherwise sustainably funded, particularly with Medicaid. And it calls out specifically primary prevention, recovery, and harm reduction. So I think, that said, it's not super specific in terms of what projects get funded. I think a couple of questions I would put out to the group thinking about if I was if I was giving direction to my staff to design this RFP process, I fully anticipate that we will have at least 10 times the amount of asks compared to the money that we have, right? I think we all know this. So thinking about, do we want to cap per grant amounts? The two biggest starting questions for me, per grant amount, and what are we thinking on capital? I know that didn't come up in the barrier conversation, but we've seen a lot of barriers with those opioid treatment program investments because they are capital. So I'm just really curious what folks think about that. And one other thing I wanted to add in addition to the ADPC plan, we have Exhibit E, right? Like one of the very basic things we could do is agree that we want, I think folks probably remember there's the core strategies and there's a broader list. And Adria, correct me if I'm saying that wrong, but I think it's the core strategies. Maybe we could agree that absolute boundary is core strategies, and then start to think about the areas that we want to prioritize, what caps might want to be, what we don't want to fund, I think is helpful to people to make sure that they don't waste their time.
Thank you, Annalise. Okay, not seeing any hands or additional questions at this point. So taking that, oh, April, go ahead.
Sorry, just when you're ready to move on. I was thinking about over the last few meetings how I've heard ideas about different strategies for RFPs, and I think there's a question that maybe would, as part of this decision of the mechanism question of around like whether an RFP, I've heard like strategies including take Exhibit E eligible activities, make an RFP that anyone could apply to, and we could evaluate by prioritized populations, and I think Annalise did a great job of grounding us in like non-Medicaid funded programs or ineligible for Medicaid services populations. There's, populations that have the highest opioid overdose rates that we can look at. Like there's lots of data to intersect that we already have to help guide where that scoring could happen. And then meets the goal of being able to leave some flexibility for innovative strategies to come in and all of that. The risk of that kind of strategy is that if it is a small amount of money, it won't stretch very far. And to folks who've said this multiple ways now, it's a lot of legwork for organizations to draft these things and participate with very little chance of actually getting a substantial amount of money. And then sometimes when we give substantial amounts of money to small organizations, it overwhelms them and they've got no structure to manage it ongoing if this is not forever funding. Anyway, but so there's that strategy of just sort of like an open, I keep referring to the New York City or New York State rolling RFP where they just kind of accept applications all year, and whatever comes in, they evaluate from this criteria. Then there's also an RFP where we could very minimize the scope of the RFP. And so we want to, to Sheriff Phillips' point, if we are already setting aside this much for Indigenous populations, Native American populations, maybe the next biggest group or another intersection that we want to work with, let's figure out a more targeted for culturally specific response or something like that. That is a smaller RFP process that we want to set aside and then continue. So it helps a single smaller RFP process like the one Lisa just posted gives us an example of something that OHA had the capacity to do and manage and could replicate fairly easily, it looks like. I'm looking for Lisa's face, but anyway. And then still gives us the ability to drive investments around the state without a more kind community-driven process or a longer engaged process. So sorry, long-winded to say, you know, there's not just like, do you an RFP or not? There's like, we could set aside an amount for an RFP, or we could create an open process, but you know, there are multiple avenues for which to use this funding and create engagement opportunities.
Thank you, April. Okay, taking a bit of a higher step back, when we think about the RF process, what are our objectives? What are we trying to get out of this process? I've heard expanding access to new folks that have not had access to state dollars before. I've heard getting creative ideas that we may not have considered before. What else are our objectives? What are we hoping to accomplish as part of this? Skylar?
Yeah, I think folks have said this before, but I think a lot of us get asked by members of the community and organizations, you know, how they can apply, and they lack a little bit of clarity on when, how, what's the process. I think anything that would provide that, I love the idea of a rolling RFP, just for folks to have that different timeline that they could apply at different times. But I think there's a lack of clarity even amongst this group of like when that is and like what that process might be. And so I think just having that we can share out and that folks can have, to me, is something that would be really helpful. I also think, just to the strategy point that Fernando talked about with ADPC, or however we kind of name that strategy, it allows us as a group to also have maybe a document that showcases what our intentions are. And I think that's helpful for the community. Even if folks aren't applying, it's helpful just for folks to see that's the intention of this group. So personally, maybe selfishly, those are like the things that I'm looking forward to, I think, if we go through our RFP process.
Thank you, Skylar. So bringing clarity to the process for folks interested in applying, having an opportunity to publicly state the board's priorities and values in a straightforward way, and then continuing to hear about wanting to make sure we're aligning with other comprehensive plans like the ADPCs. What other objectives do folks have in mind for this RFP process? Fernando?
I'm not sure if this is kind of what you're looking for, but one of the things that's occurring to me as I'm kind of wrestling with this a little bit is we have a current federal government who has come out basically in direct opposition to stuff like harm reduction and diversity, equity, and inclusion, which are huge intersectors in Oregon, right? The Native community is way overrepresented in the overdose data, and other marginalized communities as well, right? And lack access and providers. We have we don't have enough providers. We're not even allowed to really call things harm reduction anymore after decades of moving that forward. So I think one of the things I'd like to see from an RFP process somehow is keeping in mind that we do have the federal government trying to turn the clock back on so many gains that were made for evidence-based and life-saving interventions, harm reduction, and equity, culturally specific and linguistically specific services.
Thank you, Fernando. So adding to the list of potential priorities is sort of not necessarily filling the gap left by federal funding cuts, but making sure that we're considering those as we move forward and make sure that we're addressing.
Yeah, it almost falls like in my brain. Again, I process verbally. If you guys have heard me say it, like in my brain, I almost see it as like those are partially like some of the things we are going to use when evaluating RFPs. Even the creation of the RFP is the recognition that there are life-saving essential services that are evidence-based that are under attack right now from the federal government. And with the way the attacks are all coming right now is largely through withholding of funding, and forcing language to change and things like that. So
thank you, Fernando. Other thoughts on priorities for this RFP process? Or objectives for this RFP process, sorry. Sheriff Phillips?
Yeah, I think kind of the first step for any RFP is that we identify our goals. And the reason for an RFP really is that there is a process for procurement that is objective and that builds trust. I mean, that's the reason the governments always do these things, right? Is because and why governments are inefficient by design is we do things so it's very clear to our stakeholders in the community that we're doing it objectively and with fairness. And so that's what an RFP really is, at least in my book. But our job is to identify the right stakeholders and to define our project goals, what we want to do, and establish a budget.
Thank you, Sheriff Phillips. Lori?
Thank you. Just jotting some notes. I guess I wonder what our next step is if we call this good for the conversation, because I have what are much more sort of operational, like what those criteria might be or how we're talking fairly broad. And I'm thinking of things like how do we evaluate the requests, right? Things like leverage, things like geographic area and population served, things like what percentage of their org budget and program budget does the fund represent? What are their other funding sources to get at sustainability? What are their, is this operational or program, like those kinds of pieces, but that feels a little too detailed and specific for this conversation. Is that right? Like where will we get to that if this conversation ends here?
Yeah, so I think once we identify the sort of goals and objectives, we can start telescoping down to that conversation about logistically how do we reach those. And that's something that, we may not accomplish in this meeting entirely. I mean, we have the May meeting. If there's more detail needed on what OHA needs for an RFP process, for example, that might be a great time for a presentation like that, where we can get into those really logistical details. Does that sound fair?
Yes, and so then yes, thank you. It's helpful. But one thing I will say then is, while traditionally and typically and best practice and all those things that seem to not apply these days in these times that we're in, I will also just say we usually don't want to say one-time funding isn't helpful because what's your sustainability? But pulling back up to the bigger picture of our initial early days of meeting where we agreed we want to keep people alive, so that as we figure out how to build a better system, there's supports there for them, that once a person ODs, the system doesn't help them anymore. And so sometimes one-time funding, like the Save Lives Oregon allocation, does that. So it's a little bit to be mindful that sometimes it's okay to be in contradiction with what are seen as usual best practice, because we're just in such an unusual space and time in terms of what kind of funding is available and the precarity of the organizations and the work that they're doing. So I don't want us to get, I want us to use those as broad touch points for how we're structuring this, but I think we also have an obligation to in some ways throw all that out the window to an extent. And I think this is an opportunity for some organizations that they will not otherwise get, that it certainly could be. Does that make sense? Yeah, thanks.
It does. Thank you, Lori. Okay, so just want to restate what I've heard so far about objectives for this RFP process. Again, expanding access to folks that may not have been able to access state resources before, generate creative ideas that we may not have thought about before, provide clarity to the public and organizations about how they can access board funding, provide an opportunity to clearly document what the board's priorities are, make sure that when we're evaluating, we're taking into account federal cutbacks and making sure that we're prioritizing things like harm reduction that are not getting the federal funding they once did. And then this point of adaptability as well, and making sure that we're, even if we're doing some one-time funding, recognizing that that's a valuable contribution to the system as well. What else do folks have in mind for sort of these high-level objectives and priorities for this RFP? Would also like to open the floor to folks we haven't heard from yet, if you have thoughts. April?
I can wait because I've done a lot of talking already.
All right, Tammy.
I don't think that's true, April. It's great to hear. You all have so many great ideas. I would just say, and I think this is sort of understood in the conversation, but I think for me, the RFP, it allows us to be more transparent and credible as a board, that we are open to thinking outside of the box and outside of the regular connections. Just really appreciate the conversation and excited, I think, for this next journey that we'll be on.
Thank you, Tammy. April?
So I wasn't sure whether to add this comment here, sort of to Commissioner Trieger's point around it, if we're getting into the details or of the categories themselves or the process. So I'm back and forth a little bit, but just so it's said, I think we've talked about this here in past conversations, and I haven't brought it forward in a little bit, but just, the state has made some recent investments in deflection programs and in the burns programs across the state. And looking at Exhibit E, I like this list. Adria, I like this list. You heard me say it. They're great things to invest and feel complementary to those systems and help bridge those investments that are being made. I think there's some of the work that is an opportunity that is aligning well with this moment in time, is making sure that these programs have resources to create a system of care. So if at all possible, investments from this board that can fit into being that connective tissue or work with the systems that we're trying to build feels complementary, as opposed to having one-offs that aren't able to maintain or connect with those systems longer term. So I know we heard from Dr. Hoover earlier, but some of that work that is outlined that they've been doing, and some of the work here around treatment for incarcerated populations, or JMUDs, it feels really pertinent. And I just wanted to say that as in terms of our role as a state board. It's not necessarily that we're a foundation thinking about our own objectives, but I'd like to, the state's responsibility for our systems of care feels important to call through too.
Thank you, April. Sheriff Phillips?
Yeah, on kind of the strategy side, I pulled up the EDPC comprehensive plan, and when I was thinking strategy, I was also kind of thinking more about like some of the ideas I found in here, like establishing a prevention center of excellence to expand the implementation of best practices and support the growth of a primary prevention workforce. And it identifies what the problems in Oregon system are. It's a very fractured, it's inconsistent on prevention. To me, I think I would like our board to fund long-term program like that. And I could see doing an RFP for standing up what I think doesn't exist in Oregon yet. This would be a unique program, and I would hope that we'd be able to fund that, and some other programs that maybe are also in treatment, a similar program that addresses the treatment side of things. So that's where my mind's at. That's what I'd like to focus on.
Thank you, Sheriff Phillips. Any other thoughts on the sort of high-level objectives for an RFP process?
I guess, can I just hop in without raising my hand? As I'm listening, I'm also realizing this is my constant tension coming from the grassroots community, CBO side, and now being in government. I do think it's important to set up these systems, but these funds exist because corporate entities harmed communities and took advantage of them and exploited them and pushed products on them in lieu of other supports and ways of managing their physical pain, their emotional distress, and so on. And I just don't want us to lose sight of that. I don't want us to I think that's why it's important to get the dollars out into the communities. That's all I need to say. Thanks.
Thank you, Lori. Annalise?
Please let Zeb go first, because I have a question for the group.
Zeb?
All right. Yeah, I think I know this is just like an oversimplification, but we have to keep it as simple as possible. Like Annalise already talked about, like when you open up something like this, you're going to get 10 times the amount of applications and requests for monies than that there are available. We have to learn from our mistakes, learn from what have been successful, and keep this process and learn from, past predecessors and everything. Just a way to keep this as simple as possible. Keep that in mind as we create this thing. Thank you.
Thank you, Zeb. Annalise?
So that was actually a really good segue to my question. And I alluded to this earlier, but I'm going to ask it very specifically and would like to hear thoughts from folks. So I'm hearing that folks are thinking very broad, Exhibit E, all comers. But if we don't set some caps, I think we're going to find ourselves in a situation where you could either fund one thing for $13 million or 30 things that cost between $150,000 and $500,000. So what are folks thinking in terms of reach and what you'd like to see?
Sheriff Phillips?
I was thinking about Commissioner Traeger's comments about the harm done by the pharmaceutical companies. But I'm also sitting here thinking that Oregon has always had very permissive attitudes towards substance use. And if you look at decades worth of NISDA studies, Oregon's always been at the top of the nation for substance use, unfortunately, right? So that's where I'm thinking I'd like this board to be very strategic and be leaders in changing, I guess, the approach that we take to addressing this problem, right? And so again, that's why I think finding a couple areas where we can long-term fund to drive change would be good, and definitely not have the 30 different projects. Let's do a couple of them really, really well.
Thank you, Sheriff Phillips. Lori?
Yeah, I think some people can leverage or match small dollars to have bigger impact. I think we could consider having like a 2 larger grants and then a series of smaller grants and let people self-select into which one. It might also reduce competition within the dollar amounts. Or we could tell people you're only eligible for this level if your total organizational budget or program budget is below this. We could do some tiered structures to have applicants self-select into different ranges rather than just doing that for them. Because there might be people with programs. I mean, it's kind of like the conversation we had with the burns, right? Some of those are larger and some of those are smaller. Some of those are large with a small program within it. So I'd rather keep it as flexible. And if we want to do some structuring up front that way with some different ranges and letting people apply, then we will have less competition within each section to look at than a all-comers field for all the dollars.
Thank you, Lori. Julia?
Yeah, thank you for that, Lori, because my initial response was going to be that I felt the exact opposite of what Sheriff Phillips said, but I think a compromise probably is appropriate, where we're funding some, like a big thing, but I really feel like there's a value in us being able to fund just from the like one of the geographic equity has been something that I've been keen on through this whole process, and making sure that we're I think having a lower amount allows us to get into systems that that might not need to be big, but might be still very powerful. And so making sure that we're keeping that in mind. So I like the idea of maybe a 2-pot, a small grant versus large grant concept. So that's my thoughts.
Thank you, Julia. Any other responses to Annalise's question about structure and caps? Zeb? Sorry, Zeb, you're on mute.
Can you hear me now?
We can.
Okay. What I like to say is too is, for those larger number or, bigger budget proposals, I like to see a lot of the fat trimmed off of it. I've reviewed tons of grants, and sometimes there's so much fluff in it that doesn't need to be there, that smaller organizations could use that money for a staff member that's actually doing work on the streets, every day. So let's keep that in mind too when we're reviewing these grants, and they got large executive positions getting paid money or something like that. That we already took a look at that, so this money can have the most impact as possible.
Thank you, Zeb. Other thoughts on structure and how we prioritize the board's various priorities within an RFP process? Carrie? Sorry, Carrie, you're on mute.
Yay, love it. I'm not the only one that did that today, thank goodness. Well, and I think I stayed on mute because I'm a little bit nervous about talking because I like to have my thoughts pretty well formulated before I speak. And I feel like my thoughts aren't very clearly articulated at the moment, but I will, and when I talked to Annalise yesterday, like I said this to her, like I have to continue being a champion and an advocate for population-based upstream prevention. Um, that's my role, right? So I'm going to continue showing up for that. But I keep thinking about the numbers we were presented with last week, listening to April talk today about the investments that have been made in the system, thinking about the investments that our board has made, which we have made investments in prevention, but I just continue to think that we have this opportunity to change the world. And I feel like a couple meetings ago, Fernando said something about being courageous. Maybe that's not exactly what you said, but I keep thinking about, we have this real opportunity to be bold. And I think by focusing investments or at least creating some space to hold those upstream efforts that really are about preventing the problem before it happens and not reacting to the problem are just so critical for me. And I'm going to continue to keep voicing that. Um, and I was listening to Zeb talk, and it reminded me about the opportunity I had to review some grant proposals for the equity funding that OHA has distributed. And some of those were very small organizations that had some really cool ideas, and they were going to do some really neat things for, a smaller population or a smaller area, but doing things in ways to address issues that I had never thought of. And so I think there's a piece of this process that gives us the opportunity to see new ideas, new ways, and to make small investments that really will have meaningful impacts in smaller segments of the population, but will be very meaningful. Again, my thoughts weren't super well formulated, but thanks for letting me chime in.
I thought that was brilliant, Carrie. Great way to summarize that. Fernando? And now Fernando's on mute. It's a trend.
Sorry. I kind of want to ask a bit of a meta question that I'm noticing about themes in this meeting. There seems to be something in the air, perhaps because of all the public comment we already had, that somehow prevention won't get funded. And I just don't hear anyone at all ever saying in this meeting that we shouldn't fund prevention. I think the issue is that we don't have enough money to fund everything. And so even if we did give this all to prevention, it's still not what we gave prevention the first go around. It still won't sustain all the programs. And so I'm just wondering how we keep going down this kind of trail of like somehow prevention won't get funded or is not getting funded. And so I'm just not sure how we landed there. And I know that that's not the whole discussion, but it seems to kind of keep going around to like, we don't have enough money. We want to do some cool stuff, but let's give it to prevention. And it's like, where did it come about that prevention's not getting any money? If we did the same allocations that we did with the same percentages before, it'd be what, $3 million? roughly per category. So we do have to start asking that kind of like question, is just like how to maximize the few dollars we have. We don't have enough for all the RFPs that are coming in. So
Thank you, Fernando. Yeah, I think the board has been clear about wanting to, even through an RFP process, making sure that we're funding all those buckets that we've talked about in the past, the prevention, treatment, recovery. So definitely hearing that as a priority from board members as part of this process as well. Adria?
Yeah, just even though this was probably a rhetorical question on Fernando's part, I wanted to say
Now
that
we can't hear you, Adria, but it looks like you're
you
not
can't hear me.
muted.
I'm not muted. You can't hear. No one can hear me.
I can hear you. I can hear you.
I can hear you.
Everybody can hear me, but Zach.
I can hear you.
All right. Well, sorry, Zach. I'm going to talk anyway. I guess for me, and this goes back to Group 3's discussion about it. The concern about the concern about not forgetting about prevention for me was it probably came from these emergency requests that we've gotten over the years. It's never a prevention emergency. It's always a different aspect. So I think to the extent that anything I've said has contributed to that feeling of we're not going to fund prevention, for me it's coming from we keep getting emergency requests that aren't prevention, and so then we're left with this dwindling pool of money. So
Thanks, Adria. I think Zach is having technical problems. Can everyone hear me? Okay. All right. Well, so this has been a really good conversation about, it sounds like we all have said okay to this RFP process. It sounds like there's a lot of agreement on what we want to accomplish through an RFP process. There's some conversation about where the priorities are. Zach, do you want to test out your?
Am I here?
I think you're
Yay,
here.
okay.
Okay. All right. I'll give it back to you then. It's
Great.
just sort of summarizing where we were.
Thank you so much. Yeah, so I think following up on that, just as we think about where we're at and what our next steps are going to be here, we've heard, those priorities, which we'll keep in mind as we continue through this process. We've heard a little bit about structure and whether we want some smaller grants, larger grants, things like that. And then we've heard about the importance of the different what we're funding buckets last time around, making sure that we're accounting across the spectrum of treatment, recovery, prevention, all of that. So moving forward, what would be helpful for you in terms of diving into that deeper level about RFP structure? What information can OHA provide ahead of time about RFP processes that would help you? We can include the ADPC comprehensive plan in the next packet. I know that's been referenced several times in this meeting. What other information is going to be helpful for you? Fernando?
yeah, sorry, I turned my camera off because I thought that's what was causing the internet to be weird. This is one of those moments where I think we don't have to reinvent the wheel. I would love to see more information on similar situated states and how they did different grants. For example, Oklahoma did some really cool stuff where they created sort of grant RFP priorities around like equity or around harm reduction, and then use those as the categories for prevention and for treatment and for, and landing those in there. And they have like 8 different things. We have instructive models like from Colorado, who also did a set aside the way we did a tribal set aside. So I don't necessarily think that we have to start from scratch on this. So I'd love to see some more some stuff coming back on different options that we might be able to approach to at least inform the conversation if we aren't going to adopt one of those full cloth.
Thank you, Fernando. Annalise?
I would really like to see OHA bring forward their proposal for what this would look like, what the timeline would be, and what remaining questions they need for us to answer. So that would be my ask of OHA. Of the whole board, I would really ask folks to look at Exhibit E, to look at again what we funded so far, which largely came from overdose recommendations back in 2023. And I can share those again. And looking at the ADPC comprehensive plan and really thinking if there are any priorities that folks want to lift up or prioritize populations. I think if we brought that all together next month, we would be off to the races.
Thank you, Annalise. Other requests, things that would be helpful? Okay. Hearing none. Sounds like we'll have kind of a lengthy packet again, but it'll be useful information, so you'll have some homework to read through before the next meeting. Anything? I just want to open it up to OHA response to those requests. Do those seem doable? Is there more information needed at this time?
Yeah, we can definitely put that together by next meeting. We already will have several questions. Like, Annalise, were you thinking we'd put something together with the assumption that it's the entire budget? Or does that not even matter at this point? It's more about just like approach and timeline.
I mean, don't we have to answer that to post? You have to say your total amount available. So right, like that's exactly the kind of question, whatever you guys need answered before you
Yeah.
can post it.
And we do have a document, a high-level document in the packet about the questions we need answered. But we can definitely get started on at least some kind of approach or how we typically do RFPs and how long it takes.
Joanne, sorry, I'm going to hop in just specifically with a response to that. So Lisa, maybe we can chat about how potentially having some support from if there's any contract staff that could help facilitate that. I know that in designing RFP processes and procurement processes in the past, typically there are people that help put guardrails on that for the program people. So we have a lot of program people here. It'd be good to have some procurement people to help keep us in line. And maybe they can participate to help facilitate that, walking through the questions and being able to help with the what's in and what's out.
I love that. I'll definitely have someone from OC, Office of Contracts and Procurement, come and help answer these questions too. And you're right, we have to be in close contact with them from the very beginning before we even launch an RFP. So yeah, great idea.
Yeah, great idea.
Joanne? Sorry, Joanne, you're on mute.
Thank you, April. That was a really nice intro to my comment. We've talked a lot about criteria and where the buckets, how it fits with our overall strategies. One of the things I'm concerned about, and it's where April's comments and I think Lisa's comments were, is the issue of sustainability of a process for RFPs, because I think that's one of our goals, is to look at a long-term process, and how arduous would it be for any of the models that we might look at, and who would be functioning in the decision-making or review process. Would that be something that we would need to have a subcommittee of the board do? Is that something that it would be done through procurement in OHA? I guess that's my question, is not, I think that has to be part of the decision, is how difficult is this to sustain over time?
In terms of the funded projects or the staffing needed to run something like this?
my concern was just to run an ongoing or a periodic RFP process.
Oh, okay. We'll have to add.
Because I think as someone mentioned, we're probably anticipating we're going to get more applications than we ever have money for. And that takes time to glean and to figure out how does that fit in with the criteria for the RFP. And I mean, it's just time consuming.
Yes, and it's a ton of administrative work just for our little focus grants. I mean, there were 13 awards. It was, small potatoes, and I think it took over 20 staff people to put everything together. Like it's all hands on deck when we have informational webinars and community outreach, and it is a lot. As I said, OHA leadership is definitely willing to help us with that, but it does put us into all hands on deck mode when it happens.
And Joanne, to your point about the board's role, I think that's something that at our next meeting we can delve into as well, in terms of selection processes and how actively involved the board wants to be in all of that. There was a question in the chat from Annalise. Yeah, page 20 has just a basic list of what OHA needs to launch an RFP. Joanne?
Yeah, I just wanted to just tag on to your comment there, Zach, about the board's role. I think there's two things to look at. One of the things is what do we want to do? And I think what are we legislative responsible to do? So I think that both of those two things need to be part of that discussion so that we're sure that we're functioning as we're supposed to in allocating, decision making, those kinds of things.
Thank you, Joanne. All right. Any additional requests for items ahead of the next meeting that might be helpful? Seeing none. Okay, so our goal for the next meeting is to have some sort of high-level initial ideas about how this RFP structure could work, come with a list of questions that we need the board to answer before we can actually get into launching that process and fully designing it out, and then continue a discussion about OHA's role in that process, the board's role in that process, and how capacity aligns with our goals. Any final thoughts, questions, things on your mind before we head into our final public comment period today? Okay. Hearing none. Thank you all for your great contributions and ideas that you brought forward today. We'll definitely make sure we're incorporating all of that as we plan the next meeting. We do have our second public comment period of the day, and we do have someone signed up. Annalise, are you able to read the rule? Do we need to read the rules again, Jenny?
So you all turned off my video, not sure what's going on. Yeah, second public comment. I won't read the rules again. If folks could keep to 2 minutes, we'll let you know when time is up. We will bring our full awareness and consideration. We don't respond, so don't think that's unusual, and really appreciate folks' public comment. Thanks so much.
Thank you, Annalise. All right, we do have Debbie Jones signed up.
Thank you so much. Kind of for full disclosure, I'm a certified prevention specialist in Wasco County and also a member of the ADPC Commission and serve as the chair of the Primary Prevention Subcommittee. I just wanted to really thank this board for the thoughtfulness that they're having in this whole discussion of funding as well as the RFP process, and encourage you to continue to look at the whole continuum of care, which I've heard people really, already stressing that. And sometimes I think, like when Fernando said, hey, maybe if we did with that 13 million and we did it, the continuum similar to that, 3 million, prevention does a whole lot with a little bit of money. But I also want to honor some of this skepticism that might be there is because it's so hard to know if we're using primary prevention science in these activities. And because we had the legislative process where 3321 was passed, and we really have work on making sure that these programs, these activities that are happening across our state really fall into that primary prevention science, evidence-informed practices. And I think the more we'll be able to do that with confidence, this group can feel like, hey, we are investing in something upstream that's going to make a difference. I think often you hear from some of the primary prevention people because, as was mentioned, I think by board member Decker, that the emergencies get our attention. I know in old journalism language, if it bleeds, it reads. And so sometimes maybe we're a little bit too scarcity minded. But this board has shown the way of that continuum of care. And I just want to acknowledge that and appreciate that and ask you to continue to do that. And thank you so much for your time.
Thank you, Debbie. All right. So we already covered next steps for the next meeting as we were wrapping up the conversation. So we have a list of things we'll provide in the packet. And then we look forward to working with co-chairs on shaping the agenda for that meeting. Thank you so much for your participation today and have a great rest of your day. Thank you.
Thanks, everyone.